So Steve, one of the preventative treatments that a man can take to prevent further losing his natural hair even after you have a hair transplant is Propecia/Finasteride. So for my viewers' interest, I've been on Finasteride for about 3 years now. The filming of this video, it's January 2017. I started taking Finasteride consistently in February of 2014. Back in 2012, I actually took about 3 months of Propecia, 1 milligram every single day for 3 months. And a lot of the side effects, especially sexual side effects that you hear about with that drug, are things I kind of experienced. So fast forward a few years, in February 2014, I decided I was going to get back on that drug because I didn't like minoxidil. I didn't like the way that it made my head itch. So I figured that I was going to scale back the dosages. I decided to do 1 milligram every Monday, Wednesday, and Friday. And after doing that for about a year, I decided to transfer to doing 1 milligram twice a week. And that's kind of what I've been doing since about September of 2015. I take it once on Monday, once on Thursday. It seems like no matter who's out there, some people will say, well, you need to take this or you're going to lose all your hair. Or there are people who say, well, if you take even 1 pill of it, you're going to have erectile dysfunction the rest of your life. Can you tell us a little bit about your experience in taking those drugs and what kind of separated the wheat from the chaff and what's going on with Propecia?
Sure. So for the record, I've been on 1 milligram Finasteride one way or the other, meaning whether I had a 5 milligram when it was so expensive and cut it up, or just take the 1 milligram generic now for about 16 years. By the way, splitting up the 5 milligram pill is not a good idea because I found out from a pharmacist that you don't always get the average 1.25 dose. So let's take that off the table.
Gotcha.
Of course, your viewers know I'm not a doctor, and I'm not claiming to be a doctor.
And neither am I, for that matter. So.
But what I am going to explain to your viewers is what I've learned from doctors, and I've had the pleasure and the great experience of working with a few dedicated only hair surgeons that only do hair restoration surgery, and of course I'm only going to align myself with the best, who I feel are the best based on all that criteria we talked about. And a big part of the practice for these doctors is some sort of a preventative treatment. I mean, there's nothing better than Propecia to what we call put out the forest fire that's burning inside the male body of the testosterone converting to DHT.
Steve, what is DHT for those who don't know?
So the dihotestosterone in your body that is converted from the testosterone in the male body, to my knowledge, does, once you're post-puberty in life, does 3 things to the body from an adult standpoint. It can cause serious acne if you are prone to that. It can cause your hair to fall out if you're prone to that, and after 50, it can cause the prostate to enlarge if you're prone to that. Okay. So 3 things that are all negative. There's some sort of a little bit of a buzz on the internet about the whole meridian lines of the body, Eastern medicine, don't mess up what your body's doing, be natural and all that stuff. So if you block the DHT, you're being harmful to your body. So let's put that on the back burner for a second, talking about the doctors that are the specialists in the industry. You got to understand, they're writing this prescription, some of them 5, 6, 7, 8,000 times over a 10 or 12 or 15 year period. So if you think about the numbers, the numbers are phenomenal. I mean, I have worked with these doctors. I have spent time with these doctors. These doctors have spent years, studying, going to medical school. I mean, a medical license in this country is worth quite a bit of money.
Yeah.
In the big picture, if these side effects that the patients are seeing online are true and real in large numbers, think about what these doctors are putting out at stake. Their licenses. I mean, their whole careers are on the line. I know all these doctors, and they're all really good guys, and they're not going to want to take one patient. They're not going to be responsible for one patient having long-term erectile dysfunction. It just doesn't make any sense. And plus, they're going to get sued. I mean, all that. I mean, if this was actually happening, most, if not all, of these doctors that I know would be cutting off the Propecia prescriptions. Most people would lose a lot of hair. Business would spike 30 to 40% because now instead of 1 or 2 procedures with the better doctors, you're talking about the larger company business models, which are 3 to 5 procedures. A lot more money, a lot more revenue. Business would be great, and the patient would feel that they were being steered in the right direction because, of course, they're not harming their bodies because, of course, our sexual functions and ability to perform sex is much more important than hair, at least for most people out there. So I guess the point of the conversation, Lance, is that, again, has there been sexual side effects from taking 1 milligram finasteride? Yes. Do I personally, not being a doctor and work with doctors, know of anybody that that's happened to? Yes, I do. Has it been a lot? No, it has not. Has there ever been a time that I know of where a patient had a decreased libido, went off the medication, and it stayed at a decreased libido? No. Everything has always reversed.
Gotcha.
So I think that the fear is a little overblown, and you know, there is anecdotal evidence that is absolutely true in regards to what you're doing, such as, you know, it's been down to as much as 0.25 milligrams per day can be the effective amount for hair. That's all anecdotal. So there's no specific government study or pharmaceutical study that's proven that. But when I talk to patients who have fear about it, I'll tell them to start with a pill every 3rd day, or a pill every 4th day, or a pill every other day, and go for 6 or 8 weeks and see how they react to it. And there's just really not many people at all that ever have any issues.